next question that's coming. I've put on a few pounds and my enviable thigh gap has disappeared. Do I need a thigh lift to get it back? I just couldn't face that scar. So I am going to say, no, they do not need a thigh lift to get it back. In fact, I don't even think the thigh lift is the best option because it's great for reducing the circumference of thighs, but it doesn't create that nice little indent at the top, actually. Anything we can offer, I kind of think I know the answer to this, anything we can offer about that?
Definitely. So we do non-surgical fat reduction with the Coolsculpting treatment. One of the best treatments ever, as you guys know.
Don't give away our secret.
And it's a really straightforward, simple, non-surgical way to treat fat. It's essentially using cryolipolysis, so it's freezing fat cells. And what we do is we use applicators. They're in all different sizes. So we have small ones for the chin, slightly larger ones for the tummy, and then flatter ones for places like the inner thigh. And the applicator has a little cup, and the tissue, so it works on. It works on pinchable tissue, so that's where the whole pinching thing comes in that you're talking about earlier. Yeah, so we have to make sure that it's pinchable tissue, so that enough tissue can be sucked into the cup. And you use the combination of vacuum, the tissue is sucked in, and the inside of the applicator then cools to about -11, which cools the tissues down to about 4 degrees, which is the point of something called apoptosis occurring. Now, when apoptosis basically means that the fat cells freeze, they then crystallize, and then they shatter. And then the body just naturally excretes them over the next 3 months through the lymphatic system, and you are left with, on average, 27 to 30% less fat cells permanently. There's no
permanent treatment. This is the big thing. Permanent non-surgical treatment.
Permanently. So obviously, as you gain and lose weight, your fat cells don't change. They just increase and decrease in size. So apart from surgical liposuction, there's no other way to really permanently remove fat cells. So this is a non-surgical way to do it. It's not a particularly uncomfortable treatment. It feels, for the first 5 or 6 minutes, it's not the most comfortable. Obviously, you have the pulling sensation of the tissue coming into the cup, and then it starts to cool. And as it starts to cool, you are aware of it. It feels cold. But once it's got to that temperature, the area goes completely numb, and then you just sit there for another half an hour. Most cycles take about 35 minutes. You sit there for half an hour, and it just does the job. And you can watch Netflix on the TV, you can read a book, you can bring your laptop and do some work. And yeah, that's...
You know, it's interesting because over the years, I've become less and less enamored with liposuction specifically to the inner thighs. Love liposuction, do it in many places, but the inner thighs, I find that inner thigh skin has got quite poor elasticity and doesn't tend to retract and recoil, and you can end up with the contour that looks very similar to how it did before, but it'll be emptier. But that's not really much use to anyone. So I actually now preferentially direct patients towards Coolsculpting if they're after an inner thigh treatment rather than liposuction them. So here's me, a surgeon, recommending a non-surgical treatment for something. You know, I think it works better in that area.
Yeah, it does. It works really well. It cools from the center out, so you get a kind of real nice smooth result from it as it fans out. There's no sort of, doesn't tend to leave any lines of where it's been, where the treatment applicators have been, and it can give you a really nice smooth result. Yeah, we do a lot of inner thighs as well. It's one area that a lot of people don't. It's not how it looks; it's how it feels for them. They want to slim that area to make it much more comfortable, so that they're more comfortable in their skinny jeans, or they just feel more comfortable in themselves. So
the other area I've been so impressed with your results on, and it's really filled a gap that we had surgically, was the arm treatment. Because sure, you can do liposuction, but then you get a sort of floppy empty arm, and that's no good. I can do an arm lift, but that's got a significant scar attached to it. So I really only want to do that in people who have lost quite a lot of weight and have a lot of baggy skin. But there's that huge group of, I mean, most women in their 40s, 50s, would you not say? 30s, 40s.
Yeah,
Most who sort of have this sort of baggier arm or fuller arm than they would like, but certainly doesn't warrant an arm lift. And, you know, well, your results have been astounding, I've thought.
Yeah, I think it works amazingly well on the arm. It's an FDA approved treatment, and on the chin area, it has FDA approval for skin retraction. They can't quite get it on the body areas, but I see it all the time, even when people have slightly loose skin, and you think, because sometimes when you take a volume away from behind loose skin, it can look worse, like you said, with liposuction. But you can't, for some reason, with Coolsculpting, you do get this retraction. You get a swelling afterwards and an inflammation afterwards, and we tell you not to take any anti-inflammatories. So it's the body just healing itself up. It's really clever. But yeah, it works really, really well. We get amazing results, particularly on the arms, and really good results on the chin as well.
Yeah.
But tummy, like the tummy sort of definitely get great results on that. But yeah, it has been even quite surprising to me how well it's worked on the arms.
Yeah.
The lady that we saw the other day, her before and after, insane.
Yeah.
Still to come as well.
We haven't posted those yet, have we? Oh no, so that's coming.
And she's just ridiculous. She looks amazing.
Oh, yeah, incredible. Yes.
Yeah, very excited about her.
Yeah, I mean, she does look just generally incredible.
Yeah, so that hopefully that will be the before and after that's coming soon.